Everyone is wrong about using AI to diagnose rare genetic diseases. You hear the skeptics claim AI in medicine is just a glorified search engine or a privacy liability, but they're missing the most profound application of the decade. We're not talking about chatbots writing emails. We are talking about life-saving diagnostic assistance for pediatric patients suffering from conditions so rare that most doctors might see only one case in an entire career. In 2026, the integration of specialized diagnostic AI models is fundamentally changing how we approach genetic medicine. Think about the traditional path. A child exhibits symptoms, a family visits multiple specialists over years, and the diagnostic odyssey, the time from symptom onset to a definitive diagnosis takes an average of 5 to 7 years. It is an agonizing, expensive, and often ineffective process. Now, consider the alternative. AI models trained on vast, anonymized clinical datasets and genomic research can analyze a patient's clinical presentation, phenotype, and sequence data simultaneously. These systems flag potential markers that a human practitioner might miss simply due to the sheer statistical rarity of the condition. This is not about replacing the physician. It is about empowering the physician with a superpowered diagnostic lens. When a doctor uses an AI-assisted diagnostic platform, they gain the collective knowledge of millions of clinical records. The tool highlights specific gene variants that correlate with the patient's symptoms, allowing the physician to focus their expertise on clinical validation rather than initial data sifting. The impact on pediatric care is immense. We're seeing diagnostic timelines shrink from years to weeks. This speed allows for earlier interventions, better management of progressive conditions, and, in many cases, life-altering outcomes for children who previously faced a lifetime of uncertainty. The criticism regarding data security is valid, but the industry has moved toward federated learning and localized processing, ensuring that sensitive genomic information never leaves the hospital's secure environment. We are moving away from the era where a diagnosis depends entirely on which specialist you happen to visit and toward an era where diagnostic intelligence is standardized and accessible. The bottleneck for rare disease treatment has always been identification. By solving the identification puzzle, we unlock the door to clinical trials, targeted therapies, and personalized medicine that were previously out of reach. Physicians are now using these tools to bridge the gap between complex genomic data and actionable clinical decisions. It is a shift from reactive medicine to proactive, intelligence-driven care. This is the real productivity of AI in 2026. Not saving minutes on your inbox, but saving years in a child's life. The technology is here, the protocols are hardening, and the clinical results are speaking for themselves. If you want to understand where healthcare is actually heading, look at how we treat the most difficult cases, not the easiest ones. Follow for practical AI tools. Schools and parents may need new guidelines for classroom AI use this year. The ban highlights growing concern about AI homework tools in young students. This is the kind of workflow shift that shows up across industries, not just one niche use case. If you're exploring AI at work, start with a small pilot and define what success looks like before scaling. The speed of these releases means the playbook changes every few months, so save this approach for your team. Practical AI wins usually come from tighter prompts, clearer data, and human review, not from replacing experts overnight.